Hello everybody. In this video, we are going to talk about the inguinal canal. The inguinal canal is located over the inguinal ligament. So this is the inguinal ligament and this structure in orange is the inguinal canal. The inguinal canal forms in the fetal stage when the gonads that were previously in the abdomen, they descend downwards and they leave a space in the abdominal cavity. And this space that they've left behind is known as the inguinal canal. The inguinal canal, it has two openings as we can see in this image. This one over here, it is drawn with dotted lines because it's on the posterior side. This is the deep inguinal ring and this one over here is the superficial inguinal ring. So the deep inguinal ring, it is oval in shape, while the superficial inguinal ring, it is triangular in shape. So now let's look at the borders of the inguinal canal. To understand the borders of the inguinal canal, we'll use this structure over here. So if you notice, this is the inguinal canal. On the inferior side, we have the inguinal ligament. So let's draw that. On the inferior side, we'll have the inguinal ligament. On the anterior side, we have the external oblique muscle. Another muscle that's present on the anterior side is going to be the internal oblique muscle. This internal oblique will also cover a part of the superior part of the inguinal canal. Next, we have the transverse abdominis muscle. The transverse abdominis muscle is going to be on the superior surface along with the internal oblique muscle. So here we have the transverse abdominis. Over here, on the superior surface itself, both the internal oblique, which is in blue, as well as the transverse abdominis, which is in purple, will merge together and they will form a conjoint tendon. And this conjoint tendon is going to insert on the pubic tubercle. Next, we have the posterior surface. The posterior surface is covered by the transversalis fascia. An opening in the transversalis fascia, and this opening over here is the deep inguinal ring. Similarly, there is an opening in the external oblique muscle as well. And this opening is the superficial inguinal ring. Now, let's talk about the contents of the inguinal canal. The inguinal canal will have different contents based on the gender of the person. So, if it is a male, the inguinal canal will have the spermatic cord. And if it is a female, the inguinal canal will have the round ligament of uterus. These are the contents based on segregation of female or male. But both male and female will have one common constituent of the inguinal canal, which is the ilioinguinal nerve. The course of the ilioinguinal nerve is not normal in the inguinal canal, which means it does not enter the inguinal canal through the deep inguinal ring. Rather, it has a different entry point. Let's look at this figure over here on the right to understand the course of the ilioinguinal nerve. The ilioinguinal nerve is going to pierce both the transversalis abdominis and the internal oblique, which form the superior border of the inguinal canal, and enter the inguinal canal, and then it will go from inside and exit through the superficial inguinal ring. So this is how the ilioinguinal nerve enters and exits the inguinal canal. Next, let's talk about the inguinal hernias. We have two types of inguinal hernias. One is a direct inguinal hernia and the other one is the indirect inguinal hernia. A direct inguinal hernia is when the organ will protrude through the superficial inguinal ring, while an indirect inguinal hernia is when the organ will protrude out through the deep inguinal ring. So that's an overview of the inguinal canal. I hope this video was helpful. That's all we have for today. Thank you.